Health insurance shouldn't trap you in a job that you hate. I've been talking about financial independence for over 7 years now, and the number one concern I hear from people is about health insurance. 2 years ago, when I left my day job, we had to figure out health insurance on our own, since neither of us intended to work traditional jobs with benefits. In this video, I'll show you the best health insurance options for early retirees or those who are just taking a break from work in the United States. You'll learn what costs to expect, how to estimate your expenses, and what major pitfalls to avoid when getting your own health insurance. When you leave your job, your first option will be COBRA, which lets you keep your same employer-sponsored health plan. The main catch is that you'll now pay the full premium yourself. And this can be a shock. Most people don't realize how much of the premium their employer was subsidizing. For example, my previous employer covered 80% of our premium. While Jess and I paid about $250 per month for the employee portion, the full cost was around $1,250 per month. And don't forget, COBRA typically adds a 2% administrative fee on top of that. Though many people will dismiss COBRA immediately due to its high cost, there are actually 4 key reasons you might want to keep it. The first is that you've already met your annual deductible or out-of-pocket maximum. If you've hit these thresholds, keeping COBRA for the rest of the year prevents them from resetting with a new plan. The second is that you have ongoing or specialized medical needs. If you're receiving treatment for a chronic condition or need to keep seeing specific specialists covered under your current plan, COBRA helps maintain continuity of care. The third is that you're expecting major medical procedures. If you or a dependent are scheduled for surgery or are pregnant, COBRA ensures you can keep your same providers throughout treatment. And the fourth reason is that you only need health insurance for a short period of time. If you just need coverage to bridge a gap, like before starting a new job after a break from work, COBRA might be your simplest solution. It is important to know that COBRA has time limits. You can typically stay on COBRA for 18 to 36 months, with possible extensions depending on your state and situation. And if you don't qualify for COBRA extensions or have used up your entire time limit, you'll need to find a long-term solution. Since this video focuses on health insurance for early and mini retirements before a traditional retirement age, we also won't cover Medicare because that's only available to those 65 and older. After COBRA, there are 2 main health coverage options for early retirees and those taking a break from work. That's ACA Plans and Health Sharing Plans, also known as Health Sharing Ministries. Let's start with Health Sharing Ministries. While I don't have direct experience with these, I know several people who have chosen this option. And it's important to understand this is not traditional health insurance. Health Sharing Ministries are faith-based memberships where members share medical expenses. You pay a monthly share, similar to a premium, and submit medical expenses for cost sharing. However, certain expenses are excluded. And unlike traditional health insurance, these ministries have no legal obligation to pay claims. For this reason, I've avoided this option. I prefer having a concrete plan with guaranteed coverage. However, if you're healthy and your values align with one of these faith-based ministries, it might be worth considering. The most common option is getting health insurance through the public marketplace established by the Affordable Care Act, also abbreviated as ACA. These plans are typically called ACA Plans for short. Since this is the path that we chose, I'll show you exactly how to get ACA coverage, what costs to expect, and key things to consider when you're getting it for yourself. Now let's start with the basics. Anyone can view health insurance plans through the ACA, but the process varies by state since some states run their own marketplaces. I recommend everyone start on this page. I'll put a link in the description below. This page shows you where to shop for plans, either through the national marketplace or your state-specific exchange. For example, when we lived in Massachusetts, they had their own marketplace instead of healthcare.gov. Now that we live in New Hampshire, we get our ACA plan through the national marketplace or on healthcare.gov. The main differences between state and national marketplaces include the website that you'll use, potentially different enrollment periods, an application form, and whoever administers the program. All you need to do is simply enter your state on this page to see if you have a state-specific marketplace. For instance, if I enter Massachusetts, it directs me to their website, while New Hampshire keeps me on healthcare.gov. Here's something crucial to understand. Health insurance costs vary significantly between states, even for similar plans. Looking at health insurance costs across states, for a 40-year-old non-smoker, Vermont tops the list as the most expensive at $1,277 per month, while New Hampshire offers the lowest rate at $325. When we were exploring a move between these two states, we discovered firsthand that Vermont's plans, without subsidies, cost about 3 times more than New Hampshire's. Premiums are also influenced by age, among other factors. Forbes recently published a great article highlighting the average cost of ACA plans in 2025 before incorporating any subsidies. Here's a look at the average cost by age from that Forbes article. The average premium cost across all the states and ages in 2025 is $635. But that information is only so helpful because there are so many factors contributing to the cost of health insurance premiums. Because of this, the original link that I mentioned will be the best tool to help you understand your health insurance premium. This page also helps you understand if you qualify for subsidies, which can significantly reduce your health insurance costs. These subsidies are especially important for early retirees or those with lower incomes, like those on a break from work. The reality is that ACA subsidies are very complex and have been updated with recent legislation. While I can't cover every detail here, I'll outline the basics and address common pitfalls later in this video. There are 2 types of subsidies for ACA plans: the premium tax credit and cost sharing reductions. The premium tax credit lowers your monthly premium by capping it at 8.5% of your household income. It's possible for it to be a smaller percentage of your household income if your income falls between 100% and 400% of the federal poverty level. Those households that are at or under the federal poverty level won't be eligible for a subsidy since you qualify for Medicaid. That threshold is either 100% of the FPL or 138% in the states that have expanded Medicaid. I'll talk more about this in a couple of minutes. Federal poverty level calculations are adjusted yearly and vary based on your household size. Cost sharing reductions lower your out-of-pocket expenses, but only for silver plans. Even if your household income is 200% of the federal poverty level, choosing a gold plan, for example, means forfeiting this subsidy. Silver plans typically have the insurance company cover about 70% of health insurance costs, though this percentage could improve for households receiving the cost sharing reductions. And you can start to see why subsidies get complicated quickly. The website that I mentioned earlier makes it easy to understand the key income thresholds for ACA subsidies when planning your health insurance, especially state-specific thresholds. Let me give you an example. In New Hampshire, for a household of 2, the second lowest income range is $29,187 to $52,875. This range qualifies you for both cost sharing reductions and a significant premium tax credit, while keeping you above the Medicaid threshold. Here's how these numbers work. For a household of 2, the 2025 federal poverty level is $21,150. If you multiply that by 2.5 to get the 250%, you get the upper limit of $52,875. The lower number, $29,187, comes from New Hampshire's expanded Medicaid threshold of 138%. Now, if your household income falls in the next range up, you'll still get some premium tax credit, but won't qualify for the cost sharing reductions. This page guides you through selecting and securing a plan. The process is actually quite straightforward. Just follow the prompts on healthcare.gov or your state's specific website. You can quickly preview plans available in your zip code and then proceed to apply for health insurance. Now that you understand the basics of shopping for an ACA plan, let's cover 3 critical mistakes to avoid when getting health insurance on your own. The first mistake is failing to consider ACA subsidies in your planning. Whether you're early retired or taking a break from work, it's essential to understand both the income thresholds and what counts as income for these calculations. I learned this the hard way. During our first year of self-employment, our incomplete understanding of these thresholds cost us thousands of dollars. The ACA subsidies are based on your modified adjusted gross income, which includes earned income, capital gains, dividends, interest, and other retirement income like withdrawals from a pre-tax account. We didn't realize that long-term capital gains counted towards this calculation. The gains weren't taxable because our income was low enough, but they did increase our gross income and ultimately lowered our ACA subsidy. If your income will be under 250% of the FPL, consider choosing a silver plan for additional subsidies. Households with income between 100% and 250% of the FPL can get health insurance at virtually no cost. It's one of the most powerful advantages for early retirement. However, you'll need to have control over your gross income. This is another reason why I'm such a huge fan of the taxable brokerage account. It lets you generate enough income to stay above that Medicare floor, while also keeping your income low enough to qualify for substantial subsidies. But more on that later. This brings me to the next mistake to avoid, which is overlooking Medicaid eligibility. As mentioned earlier, if you're eligible for Medicaid, you won't qualify for ACA subsidies. While you can still get an ACA plan while eligible for Medicaid, you'll have to pay full price for that plan. We've avoided this mistake since we generated enough income from our business each and every year. But it's an easy trap to fall into during early retirement or even a gap year. The best strategy to maximize subsidies is to ensure you generate enough income to stay above the Medicaid threshold. This could be earned income, but it could also be interest, dividends, rental income, or even capital gains. It's worth noting that these thresholds vary by state. Most states have expanded Medicaid coverage, but not all of them. You can easily check if your state has expanded Medicaid with a quick search. And that link I mentioned earlier clearly shows all of the relevant income thresholds. The final mistake to avoid when choosing a plan is overlooking provider networks and drug coverage. We learned this the hard way in our first year. Even though we stayed with the same insurance company, the ACA plan had a different network than our previous employer-sponsored plan. As a result, we had to switch our primary care physician, and it took months to get an appointment with our new PCP. Before selecting a plan, verify that your preferred providers are in-network and that your medications are covered. Now, this video can't cover everything about health insurance. I'd love to know what I miss, so let me know in the comments what other information would be helpful for other viewers to know. And to learn more about optimizing for low income years, watch this video about using your taxable brokerage account. Planning ahead now can help you minimize taxes and maximize your ACA subsidies. Thanks so much for watching and enjoy the journey.